What are some of the signs of postpartum depression? When we look at postpartum depression, it's a very serious illness. We take it very seriously and we treat it very aggressively. The reason being, in the worst case scenario, it can be a very difficult and debilitating disorder. So what are the symptoms? When we see the baby blues a lot, where patients they're emotional after delivery. There's a lot of change going on, a lot of physical changes, a great deal of emotional changes during that time. But the hallmark, or the key, is the baby blues last for 3 weeks. Anything that persists beyond 3 weeks is concerning. So in those patients, we'll see irritability, moodiness, frequent crying. Some patients will even have the feeling to harm themselves or an urge to harm their infant. If we get to that level, that's very serious. But most patients know that there's something going on. They can sense that. If it's getting to be very worrisome, very concerning, they start to have these feelings of harming themselves or their infant, they've got to call us immediately. And that's independent of that 3-week cutoff. But again, classically, we don't see a lot of this until after that 3 weeks. But again, we treat it very seriously. It's a disorder like any other. A lot of patients, when it comes to treating depression, whether it's postpartum depression or depression at another time, they feel there's a stigma there, or it's a sign of weakness, that if they were just tougher, they'd do better. And it's exactly the opposite. It's a disorder that we can treat, and we don't want patients to feel that way or to steer clear of treatment because we have so many options to help these people. We want to make that first several weeks, the first few months of childhood, a positive time, a positive experience for both the mom and child, so they can bond and do well.